We are living in an era of remarkable progress in health, with improved living conditions, medical advancements and public health initiatives. But while we are living longer, we are not necessarily living healthier. Before diving into the European Health Report, I'd like to acknowledge that, as all of you know, WHO is going through a challenging period right now. Yet, our core mission remains disseminating science and evidence to inform action. And this report is proof of that. So let's get to it. In 2024, for the first time, there were more people over 65 than under 15 years old in the European region. And projections show that there will be 3 times more people aged 80 plus by 2050. However, there is a 10-year gap between life expectancy and healthy life expectancy. This means millions of people in our region spend their last decade of life in poor health. They struggle with chronic diseases, disability, and lack of access to adequate care. On top of that, currently over 14 million people in our region are living with dementia, a number set to double by 2030. So if we do not act now, the gap between living longer and living well will continue to widen. So we must change our approach to ensure our populations not only live longer, but age in good health. And good health should really begin during childhood. Childhood sets the foundation for lifelong health and well-being, yet key indicators are stagnating or even worsening across the region. Consider this: every year in the region, nearly 76,000 children die before they turn 5. In several countries, childhood mortality is stagnating or even increasing. And there is a 21-fold difference in under 5 mortality rates across the region, which is unacceptable. Our young people are also facing new and evolving threats. Up to 23% of adolescents in the European region now use e-cigarettes, an alarming trend that risks undermining decades of progress on tobacco control. E-cigarette use among young people now even surpasses cigarette smoking in many countries. Also, 1 in 3 children is overweight and 1 in 8 is living with obesity. What concerns us the most is that childhood obesity is not just about children. It sets the stage for a lifetime of increased risk of cardiovascular disease, diabetes and other chronic conditions. Social media, online harassment and digital dependency are increasingly affecting young people's well-being. And without action, the next generation will not only face a high risk of chronic disease, but a growing mental health crisis. Girls consistently report lower mental well-being compared with boys, with 15-year-old girls scoring 50 and boys scoring 62 on a 100-point scale. Life satisfaction and self-rated health have also declined since 2018, especially among adolescent girls. Beyond mental health, girls also face a high risk of harm and mistreatment. In fact, more than 1 in 4 women and girls in the region experience violence in their lifetime. At the same time, men die by suicide at a rate 4 times higher than women. And this is sobering. Suicide remains the leading cause of death among young people aged 15 to 29. Turning to infectious diseases now. Vaccine-preventable diseases are resurging. In 2023 alone, we saw 58,000 measles cases across 41 countries in the region. And 87,000 cases of pertussis or whooping cough, the highest number in a decade. These diseases should be behind us, yet they're making a comeback due to declining vaccination rates, often fueled by misinformation and gaps in our healthcare. Only 7 member states in the region have achieved greater than 95% coverage for the diphtheria, tetanus and pertussis vaccine, measles vaccine and pneumococcal vaccine. And while some member states showed near complete coverage of these vaccines, others showed disparities. A low coverage rate of 62%, for example, was experienced in some member states for the measles vaccine. These figures highlight substantial inequities in immunization coverage, with some countries making remarkable progress while others continue to lag behind. Meanwhile, antimicrobial resistance, or AMR, remains a critical threat to global health. We are also falling short in tackling infectious diseases such as tuberculosis, HIV and hepatitis C. Despite a 25% reduction in tuberculosis incidence and a 32% decrease in tuberculosis deaths between 2015 and 2022, drug-resistant tuberculosis remains a challenge. Drug-resistant TB accounts for 1 in 4 new cases and over half of previously treated cases. But there is reason for optimism. New evidence shows that a drastically shortened 9-month treatment plan only with oral drugs for multi-drug resistant TB achieves a treatment success rate of 83%, significantly surpassing the current average of 57%. Previously, treatment for drug-resistant TB could last up to 3 years with painful injectables. Turning now to non-communicable diseases. Despite progress, 1 in 6 people in the region die before the age of 70 due to the 4 major NCDs: cardiovascular disease, cancer, diabetes, or chronic respiratory diseases. Cardiovascular diseases remain the top killer, especially in Eastern Europe and Central Asia. Cancer is close behind and is exerting significant pressure on our health systems, particularly in Western Europe, where people are living longer. But it's not just genetics and aging, it's also and very much lifestyle. Our region is home to the heaviest drinkers in the world, with adults averaging nearly 9 liters of pure alcohol per year. Tobacco use also remains high at over 25%. Almost a quarter of adults are living with obesity, a 20% increase since 2006. In some countries, obesity may soon overtake smoking as the leading cause of preventable cancers. That's why the health systems must transform to meet changing health needs. Despite record numbers of health and care workers, they are not effectively distributed. As demands for service increase, workforce supply cannot keep up. A further challenge is the aging health workforce. Across the region, 30% of doctors are over 55 years old and quickly approaching retirement. Out-of-pocket payments for medicines, particularly for low-income groups, burden families and push us further from universal health coverage. Up to 1 in 5 households in some parts of our region have to forego basic needs like housing, heating, or education to pay for healthcare. And finally, very worrying, our health systems are no better prepared for emergencies today than they were before the COVID-19 pandemic. The European region stands at a crossroads when it comes to the future of health. As health systems face increasing strain, more of the world remains unsafe. Avian influenza, mpox, and Marburg virus do not respect borders. The European region must be bold and innovative in its efforts to build healthier, more stable societies, but we must also realize that health security is key to national and international security. Keeping health high on the agenda means working together to build a safer, more resilient world. Thank you.